This is episode 2 of How It Rocked My World. What is it, you ask? Well, it could be a number of things. It could either be mainstream gynecology, endometriosis, pain, or technology. It's kind of all of the above. So moving forward, last time I talked about my experience with my first gynecology visit ever and how I was having a lot of pain. And I know that a lot of women have this problem. I basically went to the gynecologist and had these complaints, and she offered me birth control. I didn't want it, and that was it. That was the extent of that visit. That was really disappointing to me. I felt like I walked out of that doctor's visit with not enough options. I could either take the pill and have the side effects and have it doing things to my body that I did not understand, but maybe it would get rid of my symptoms. I could not do anything and continue to live like I had been, experiencing the pain and the heavy bleeding, etc. And there was a third option that I did not know that I had, but I'm gonna get to that later. So let's see, I said I was about 18 years old at that point. I had just started college. It wasn't until 5 or 6 years later, I was in my mid-20s. I was laying in my bed and I got woken up really early in the morning with a stabbing, sharp pain on my left side in this general area. I assumed it was my leftover, I don't really know. And I couldn't move, I could barely breathe. I couldn't even get out of bed. So it came and it went for a couple of hours. So then next day I called my gynecologist to see if I could get an appointment. Obviously this concerned me. I had that period pain every month that was pretty bad, and the heavy bleeding, like I said, but I never had such a sharp pain like this. I never had an experience like this. So, and just as I'm thinking about it, I am realizing the bigger problem of this whole experience. So I went into my gynecologist's office. She couldn't see me, so I saw the nurse practitioner. She did an ultrasound and she found a cyst. It was the first ultrasound I had ever had. She actually said, okay, since we found a cyst, I'm not gonna charge you for this. I don't know what that meant. Did she think it was all in my head? I know a lot of women feel this way, that they keep getting told that it's in their head. These are not serious problems, and it's not the truth, And so I guess she was like, oh, okay, this girl really was experiencing something. I don't know. So she said, let's schedule an ultrasound in 4 or 6 weeks or something. She wanted me to come back, I guess, to see if the cyst would go away. We do get cysts that are normal every month that come and go. I don't know. So anyway, I came back to this very well-known throughout the nation hospital weeks later to get an ultrasound done by a ultrasound technician. A radiologist would read that one. I never got the results. That was it. I literally must have fallen off the face of the planet for that doctor's office. Nothing happened. So I waited, let some more time pass, and then I changed doctors. I changed hospitals because I didn't want to be treated like that. And so I went to another very well-known hospital in my area, a very good, well-known doctor too, and I felt much better, actually. So I went to see her. She saw me in her office and we had a good little conversation, and right away she took me down the hall to do an ultrasound in the office, and I felt much better about that already. The ultrasound technician starts doing her thing and she's making faces like she's seeing something that doesn't look too good. That was it. I got to go right in and speak with the doctor, which I was very pleased with. And that's when this new doctor asked me if I had ever been diagnosed with endometriosis. And that was the first time, I think I was 24, 25 years old, that I had ever heard of the word in my entire life, which is so surprising and a disservice to women because it's such a common disease. And I have been having a period since I was 13 years old, and here I am at 25, and this is the first time I've ever heard of this word. There's a problem. There's not enough education or understanding, even in our own doctor's offices, if this is the case. So what is endometriosis? And she kind of explains this to me, but basically inside of our uterus is the lining. That's what sheds, the endometrium. It sheds every month that we have a period, and that's what causes the bleeding. Well, with endometriosis, there's little pieces of that lining that are implanted on the outside of the uterus, or it could really be in any organ or on top of any organ within your pelvic region, and even some other crazy places. It's pretty amazing, but that's much more rare. So I pulled up WebMD to get the official list of some symptoms of endometriosis, because it's probably a little more than you would think. So we've got painful periods, obviously. You can have pelvic pain and cramping before your period, extending several days into your period, and you also may have some lower back and abdominal pain. Pain with intercourse, that's something I've also experienced. Pain with bowel movements or urination, excessive bleeding, heavy periods or even bleeding in between periods. Infertility, obviously, lots of times this says endometriosis is first diagnosed in some women who are seeking treatment for infertility, which is also so frustrating, because why is it not until someone learns they are infertile that they're diagnosed with endometriosis? This is something that can be diagnosed right when, in the early years of a girl who has just started her period, if she's charting. This is so frustrating. Other symptoms: fatigue, diarrhea, constipation, bloating, or nausea, especially during the menstrual period. Now, a lot of people can have these symptoms and it not be associated with endometriosis. That's true. But I think there are a lot of women, a lot of girls in high school who are experiencing many of these symptoms and are told that it's all in their head or that they should just deal with it. And that's not okay. So, moving on. I was looking up some information on endometriosis. This is a part of the talk that I give locally. I found a statement from Dr. Patrick Young, who's an associate professor and director of the Center for Endometriosis at the St. Louis University School of Medicine. He says historically, endometriosis was known as the working woman's disease because it was thought that it only affected women who waited later to have children and then struggled with infertility. Now, however, endometriosis is recognized as affecting 10% of women of all ages. That is about 176 million women and girls, and is one of the most underdiagnosed diseases. Up to 1 in 2 women with endometriosis develop issues with infertility. Here's one of the biggest problems. In mainstream gynecology, the way that endometriosis is diagnosed. It can only technically be diagnosed by a biopsy, which you take during surgery. And young girls are going into their first gynecology appointment, or they're just going in for pain, not even necessarily to their gynecologist, but to their general practitioners and saying, I have pain. Whatever the reason, there's not a lot of looking into it, not a lot of problem solving. There's a lot of offering of birth control. And so that's how a lot of girls start on birth control, and then just from then on, there's no looking into diagnosing a disease. They're just trying to avoid surgery. And as we know, as Dr. Hildreth's research has suggested, that, look, we can't get around it. Endometriosis is a surgical disease. That is just the truth. So these girls are getting on birth control. There's no research to indicate that the endometriosis does not continue to grow, but they're just not feeling the symptoms. There's what I have read, something like an average of 10 to 12 years to be diagnosed. And that's the problem, because there's damage that's being caused to our organs for so many years. There's no wonder we're having trouble getting pregnant. If we could take care of it right away and find a treatment plan that works, that is effective, that cooperates with our bodies right away, we might not be having this problem. It's crazy. This is a novel concept. So for me, I got told basically that I may have this disease. This was actually my birthday. I didn't mention this. This was on my birthday. I got asked if I had ever been diagnosed with endometriosis, and then told that I do need to have surgery. Happy birthday to me! Basically, she sits me down, she educates me on this disease, which I really appreciated. I felt this doctor took much better care of me than the other doctor that I had. She said, A, you need surgery, and B, you need to get on birth control right now. Here I am in this situation again. This time not really being offered birth control, but kind of being told, like, not in a bad way, not in a mean way, but just like in a way of like, no, this is how it is. Like, this is just what we do. we get on birth control. And again, here at the time, I didn't know anything about this at the time. I was just kind of like a deer in headlights, like, hey, I've just been diagnosed with this disease and I need surgery. And so immediately, here's the other thing. We trust our doctors so much, and as we should in most situations, you know, we want to develop this trust for our doctors, and that is a good thing. But it's kind of this situation where we're in this culture that we don't have a lot of education, and I think that we have a responsibility to ourselves and to our daughters, to other women, to our friends, to do our own research. You know, we don't just have to take the words that the doctors say as fact. Look into it yourselves. But at the time, I was just like, yes, ma'am. Like, okay, this is what I need to do. Of course this is what I need to do. She's a doctor. She knows what she's talking about. So I said, okay, yes, like, okay, I'll do it. Like, she scared me, because here's the idea, and here's what I believe most patients are told, is that the idea behind the birth control is to, first of all, take away your symptoms and your pain, which is a good thing. If that actually happens, it does not happen for everyone. So to give you pain relief, but also to preserve whatever's in there until you're ready to have children. Now, as I understand, like I said, there's no research to indicate that the endometriosis does stop growing. But this is what I was told. That's the idea behind it, because I told her that I did want to have children. At this time, I was in a serious relationship. We were planning on getting married not too far off in the future. So obviously, again, here I am in a position where I'm uneducated, and I just don't know what else to do but to trust what she's saying. So she gave me some free samples of birth control, because evidently it needed to happen like the second I got home from the doctor's appointment. I don't know, so I took them, I scheduled the surgery. So I went home, and then luckily I started to do some research. It just didn't sit well with me. I needed to have more information. It just didn't make sense. Like I said, from the first time I stepped in to a gynecologist office, it didn't make sense to me. And our other doctors, other kinds of doctors, like, you go in for, you're not feeling well, if you're sick, you go to your doctor, there's all kinds of information they want to get from you. You know, like, is there mucus coming out of your nose? What color is the mucus coming out of your nose? When did it start? Like, have you been out of the country in the past 3 months? Like, I mean, I feel like they want everything except your social security number. Oh, no, they do want your social security number, that's not true. But they're asking all of this information from us in any other type of practice except the gynecologist's office. We walk in and we're not expected to give up any information, even when we want to. Like, I want you, learn about what my problem is, like, learn about what my symptoms are, learn about factors, learn about my diet, learn about all these other things. And it's okay that we're just given a prescription for birth control. You know, they don't just usually walk and give you a Z-Pack or these other, you know, antibiotics or these other things. It's just not that simple, I don't think. So why, when we're dealing with something that is so important to our health, our fertility, our very womanhood, why is that not being taken better care of? Why don't we see that as more valuable? Just something to think about. Like I said, I did not end up taking the birth control, but I'm gonna get into what happens next week. I hope y'all stick along with me. Share this video so we can get this news out, so that other people, other women do not have to continue to experience these things. And subscribe to my page, and I hope you follow along this journey with me. Y'all take care, and I'll talk to you soon.